Treating cancer requires pushing the human body to the absolute brink of its physical endurance. Traditional therapies like chemotherapy and radiation are highly effective, but they are indiscriminate. They hunt down the tumor, but the collateral damage includes wiping out your healthy immune cells and completely draining your energy reserves in the process. Patients find themselves fighting a two-front war. They have to battle the disease itself while simultaneously trying to survive the loss of their own natural defenses. For decades, oncology has relied on methods that inflict severe physical tolls on the patient, but modern supportive care involves fortifying the weakened host. Cholecalciferol, or vitamin D3, serves as a proactive, science-backed biological shield for the host. Vitamin D3 is a fat-soluble vitamin that the skin synthesizes from sunlight, functioning in the body as a pro-hormone to regulate various physiological systems. Beating the disease requires eradicating the abnormal cells, but it also requires actively rebuilding the patient's compromised biological foundation so they can withstand the treatment. Because oncology drugs deplete white blood cells, patients are left highly vulnerable to opportunistic secondary infections. A simple cold can become a severe threat. Vitamin D3 acts as a master immunomodulator, connecting to dormant T cells and macrophages and sparking them to life. These empowered white blood cells then surround and kill microorganisms, actively hunting down infections to provide a necessary defense system when the body is weakened. Beyond fighting infections, D3 regulates a process called apoptosis. Apoptosis is the process of programmed cell death used to eliminate cells that are no longer needed or damaged beyond repair. By maintaining this cycle, D3 prevents abnormal cell growth from spiraling out of control. It actively deputizes the body's surviving cells, giving them the chemical instructions they need to maintain order and fight off deadly secondary threats. The collateral damage of treatment also extends to the skeleton. Hormone therapies, which are frequently used for breast and prostate cancers, frequently trigger rapid bone thinning and osteoporosis. This clinical report details exactly how this works. It notes that the active form of D3 plays a major role in clinical medicine, precisely because of its strong effects on bone metabolism and calcium homeostasis. The digestive system cannot absorb dietary calcium on its own. It relies on D3 to facilitate transport across the intestinal barrier into the bloodstream. That calcium is then routed to the skeleton, acting like mortar to fill microscopic gaps and reinforce the bone framework. A patient could consume the most calcium-rich diet possible, but without D3 to process it, that calcium passes right through. D3 is the indispensable armor protecting the patient's physical mobility during recovery. There is also an invisible toll to these treatments: crushing fatigue and deep depression. Vitamin D receptors are concentrated in the brain. When activated, they directly influence the production and flow of key mood-stabilizing neurotransmitters across the synapses. Optimizing these levels directly regulates serotonin and dopamine. This provides a chemical countermeasure to the depressive symptoms induced by harsh medications and the psychological weight of the diagnosis. This chart visualizes that clinical link. It shows a stark downward trend in major depressive symptoms, correlating directly with the introduction of D3 supplementation. Managing a patient's neurochemistry is a critical component of giving them the mental stamina required to endure and survive their treatment. Because cancer treatments severely compromise the digestive system, patients often lose the ability to extract D3 naturally from their food. Pharmaceutical-grade supplementation, specifically utilizing softgel technology, bypasses that digestive distress. The softgel dissolves rapidly, allowing the compound to directly and completely enter the bloodstream. Modern softgel technology offers a level of bioavailability and dosing precision that historical, crude attempts at ultraviolet exposure simply couldn't achieve. Patients can actively advocate for their recovery by asking their oncologist for a 25-hydroxy vitamin D blood test. This is a standard lab test that checks their baseline serum levels to see exactly how much supplementation is required. A cancer diagnosis strips away a lot of a patient's control, but integrating vitamin D3 allows them to actively defend their quality of life, acting as an essential companion in the fight for survival.